So, hello guys, we have Dr. Saurabh Chaubey with us today. And Dr. Saurabh, he has been working with Triple IT Delhi. He has been working for innovations. He has been working for startups. So, every information we could get out of them, we'll definitely get it on camera for sure. So, first of all, Mr. Saurabh, how are you today?
Yeah, I'm great. I'm doing great.
You're doing
I'm
great?
very excited to see so much happening, so much around innovation.
Right. So, like, I also saw many young innovators today, right? And I thought that it was wonderful. Like, India is booming with the innovators nowadays. So, it was a very good thing for me for sure. So, I'll straight up come up with the questions, right?
Sure.
So, since Saurabh sir, you have done many things in innovation, technology, and all these things. First of all, would you like to draw some points for the young innovators out there who want to make startups, who want to go for innovation? Like nowadays, people are not posed too much towards startups.
Right.
They're asked to do jobs and all these things.
True.
So, anything that you would like to tell them first of all?
Right. I think it's a perfect time for any person to do a startup.
Mm-hmm.
Of course, doing a startup is a risky work.
Right.
But the kind of support system which is available today was not there earlier.
Mm-hmm.
And anyone who is thinking about doing some innovation,
Mm-hmm.
there are now a lot of support available. I will talk more about how and we are Triple IT Delhi and the Department of Science is supporting such research and innovation work, which can translate into a startup.
Right.
So basically now, like many of youngsters might be aware about that government is giving fund to do a startup.
Right.
They are supporting through mentoring and other the support marketing support to the startup. And now the government has taken a step to set up technology innovation hubs across India.
Right.
And these innovation hubs are given a particular technology to focus upon. So like Triple IT Delhi has been given technology focus of cognitive computing and social sensing.
Right.
So now the Triple IT Delhi is setting up this technology innovation hub.
Right.
It's bringing the researchers, innovators, government, corporate, and startups together on a single platform to facilitate that each innovation which is coming out of this TIH is going to create a commercial value. And because because we are in a very exciting time, we are seeing that whether it's the complete e-governance or smart cities, each requires a lot of cyber physical systems.
Right.
And government, because of that, keeping in mind, government made this plan to set up this technology innovation hubs to ensure that any innovative mind gets support at the right time, with the right type of support resources.
Right. So, sir, since you talked about hubs,
Right.
So, I would like to know, like, is it accessible to all, or are these specific to IIT and triple IT students or innovators only?
No, it's available to anyone who is thinking about idea. So basically, you need to bring out your idea,
Right.
get validated through discussion with experts, mentors, and then once you have that validation,
Right.
You can apply for various support through us. So we fund research projects, we fund startup ideas.
Right.
So any innovator is thinking in that direction can come to us and submit his idea proposal. We have, of course, the templates available on our websites. They can download and fill it up and share with us.
Right. So, sir, just to give an idea of all this to our audience, I would like to know any 4 or 5 startups that you personally liked, or Triple IT Delhi or this TIH has funded till now, so that they also get to know what kind of ideas they must come up with.
Right. Exactly. Sure. So we actually just started last 1.5 years back. We have currently onboarded 2 startups with us.
Right.
So the one of the startup is the Core Over Private Limited.
Okay.
Which has built the you would have seen on IRCTC website or Hero Motors or any big large corporate companies. There are the virtual assistants,
Right.
chatbots, and now they're developing into a much more interactive chatbots, virtual assistant in forms of video or audio assistance.
Right.
In fact, the IRCTC website itself, this is that virtual assistant there,
Right.
which is now very dynamic and very active, interactive.
Right.
And these are developed by the same startup Core Over.
Right.
They are fantastic, doing well, and they're looking to build much more business out of that.
Right.
And that's why we have supported them.
Right.
And then again, the another startup we have supported is Neuronics Lab Private Limited. Neuronics.
Right.
So basically, this startup is building very affordable diagnostic services for people, especially in rural area or tier 2, tier 3 cities. So like he talks about that if in India we are talking about 10 minutes delivery, why not 10 minutes diagnostic services?
Right.
So he's built his own hardware which is supported by the software,
Right.
which is going to enable a very low cost diagnostic services And particularly, of course, we know in metro cities might be we have very faster or quicker diagnosis.
Right.
But in rural area or tier 2, tier 3 cities, we face
there is no diagnosis at all at some places. Yeah.
Exactly.
Right.
So it's a challenge for them. They have to wait for a day or 2 days to get the result of
Right.
the test done and all. So he's making that. So he's already developed the prototype. He's getting it validated, getting tested across different agencies. And once he has that all licenses, he will be launching it commercially.
So you are basically recognizing people who are adding value
Right.
to the country, to the people of
Sure.
country, and to the they are also adding some integrity to the country. Right. Integrity is the most important thing here.
Sure.
Right. It should not just be focused on money. It
Right.
should be focused on people's well-being.
Right. Exactly.
Right. Getting it accessible, getting it at low cost, getting it everything done.
Right.
That is something which is more important.
And just to add to that, why I will just highlight why it's important to
Right.
have this kind of support system and what we are expecting from our youngsters or innovators. Because we all are wearing these wearable devices.
Right.
And this all wearable devices are coming from external countries,
Right.
China or the other countries.
Right.
And we don't know what intention they might have in
Right.
the future. Right. This
Right.
data, and we are basically we are creating a great danger to our national security, because
Right.
this data is going to their servers. They might use it in any other way.
Right.
And that's why it's very important that we Indians should produce these devices. We should have our own data at our hand. So that's why we are encouraging our startups, particularly like the social sensing or the cognitive computing, where we look at, and now coming to particularly the point of the digital health. Now we connect that with all wearable devices. Even in fact, we have funded one of the startup in this area who is basically developing such wearable device who will collect the data, and then the whole data will come together.
And then you can analyze it.
And it will be available to all the researchers, Indian researchers, so that they can analyze this data. They can
Right.
draw the conclusion, inferences, and then use it for the benefit of the society. And also at the same time, what we see that our hospitals, our health agencies, they are developing tons of data,
Right.
and this data is not being used by researchers.
Right.
So that is where also we are focusing, that we want to bring those resources, that we bring this data to the researcher, innovators, and then they can innovate
Right.
based on those data points.
So the idea is, number one, associate with the Made in India thought.
Right.
Number two, do not let your data go anywhere, because data is the new fuel.
Exactly.
Right. Number three, people might misuse you.
True.
So you must use your own self. Right.
Exactly.
Right.
Exactly.
So sir, since you talked about data technology, data integration, and all these things, I would like to know how the data that we are generating via electronic health records could be useful in the future.
Right.
There is a lot of data that is created, that like PACS is creating lots of data, right? MRI machines storing people's health records. Recently, you heard the news of AIMS, right?
Right.
Therein a cyber attack happened,
Right.
and patient data of nearly 2 crore patients were taken, right? So cyber security is also a very big thing in this. So how would you ensure the privacy to people, cyber security to people, and second of all, the right use of data?
Right. Exactly. So I will highlight on that why this innovation is required, particularly on the how to leverage this data which we are producing through our government hospitals or the multiple hospital chains vertically. So basically, if you see that, if I take an example of the COVID cases during that pandemic period, the main challenge was not we did not have the bed or the oxygen concentrator. We were not able to optimally use those resources.
Right.
That was the biggest challenge, and because we did not have the data on our hand that how many beds we are having, how many oxygen concentrators we are having, what are the chances, where the propensity of having the more COVID patient and all. And this data can actually easily be recorded, and that can be used to devise our strategies. And also, when we look at the policy maker level also, so in fact, several of our startups are working on that area,
right?
That all the data created by our government hospitals, government hospitals in tier 2, tier 3 cities, rural areas, and all,
right,
that data can be converted into digital form, and then once that converted into digital form, that gave us a leverage to analyze centrally.
Right.
So that's an example of, I take a state of Delhi,
right,
and I look at all the government hospitals, if they are converting their data into digital form,
right,
it comes to a central body, and that central body analyze that, okay, what are the chances, which disease is having a more chances of to spread in which location,
Right,
place,
right.
and then they will give us insight about what is the correlation between those propensity of
Right.
happening there,
Right.
and then we can plan it accordingly.
Right.
We can focus on those areas. We can bring that resources. We can plan it at what time of a year we require for particular disease. What kind of resources we require, right? So those kind of things we can infer from this data. And then when you talk about the security of
the data security,
like
cyber security,
and of course that's a perfect example. And now because it's visible, that came into news, we know that now, okay, there are 2 crore people data at risk.
Right.
These people are demanding money for that.
Right.
Now, what is not visible is that for crores of Indians, data is in hands of foreign companies.
Right.
And we don't know they are using this data for what.
And who those person are, right?
Who's those person are, right? Exactly. And that is going to be, they are going to make much more damage to us if they want to,
right,
using this data.
Right.
So it's very important that maybe we may buy a little, more pricier, costlier wearable device.
Right.
It should be an Indian manufactured device.
Right.
So that the data, we ensure that we have the data stored in our service. The foreign people don't have access to that data.
Right.
And then, of course, that data can be used definitely for more research, more innovation.
Right.
And that is going to pay a way for future innovators.
Right. That is great to know about this. That was really a good piece of information. But I'll like to draw a point from this. Since you talked about data, saving the data somewhere in India itself. Majorly nowadays, people are talking about cloud. Right. Saving all the data over cloud is the new thing that is happening. People do not have systems nowadays.
Sure.
Right. So, does India have its own cloud wherein people can save the data, or the cloud is also owned by foreign countries itself?
Right. Exactly. What I would say that India is definitely making progress in that direction. We are like heavily dependent right now. If we talk about the present scenario, definitely we are heavily dependent on foreign countries or service providers, whether it's AWS or Google Clouds. We are heavily dependent on them. But I think now the government has realized that that we need to have our data at our source.
Right.
So that they are setting up those huge infrastructure. They are encouraging, giving benefits and incentive to Indian companies to set it up. And yes, definitely, because from time to time, it has been proved that no system is foolproof. There has been leakage, whether it's from the Amazon or from other companies. There has been proved that there is some sort of data we don't know that how it's going to be used.
Right.
Whether the US government is going to use the data or Chinese government is going to use data.
Right.
So yeah, of course, it's needed to do that, or at least something they have to either govern by our law. We have to ensure that the data is being saved with the trusted agencies.
That will ensure the near future for sure. And this will end the session. But I'll like to ask Dr. Saurabh one more question. That, sir, since you talked about people can approach you on TIH, could you give them any email address, any ID, anywhere where they can reach you and approach you?
Sure, definitely. Please reach out to me at CEO. Right, and then at iHub Anubhuti IIT
right
.org.
Right.
And you can also check out our website iHubAnubhuti .org. Do reach out to us in case of you have any innovation idea, and definitely we will be in terms of cyber physical system. We are part of that network of 25 technology innovation hubs.
Right.
So we may or we can connect to the other TIHs also.
So guys, come up with your ideas to his email address that you will find in the description below for sure. And Helen will end our session with Dr. Saurabh. And it was lovely meeting you, sir. Thank you. Thanks a lot. Stay healthy.